Hey everybody, it's Dr. Eric Balcoucher back for another edition of Thyroid Thursday. And today we're covering a topic that somebody asked me about, and that is thyroid optimization. So what does it mean? And is thyroid optimization really optimizing thyroid physiology, or is it actually manipulating thyroid physiology? Let's have a little discussion. So let me give you a couple examples. If somebody has primary hypothyroidism, their thyroid gland is not making enough T4 and not making sufficient T3, and they get T4 medication, is that optimizing their function, or is it manipulating the levels of T4? Okay, I would look at that and saying, well, it's probably manipulating the levels of T4. Okay, not that that's good or bad. I'm just saying I would look at that as more manipulation. If a person has decreased T4 to T3 conversion, and you'll hear me talking about this and other talking heads talking about decreased T4 to T3 conversion, still resulting in signs and symptoms. And if somebody gives you T3 medication to raise the level of T3, is that optimization or is that manipulation of the T3 value in the blood? A couple more examples. If you had a 35-year-old female who has low estrogen and low progesterone, and that person's put on estrogen and progesterone hormones, did we optimize her health or did we manipulate her blood values? Okay. And one more. If we have a 50-year-old man who has low testosterone and elevated estrogen, and we put him on testosterone replacement and give him an aromatase inhibitor, did we optimize him or did we manipulate his labs? Okay, so these are questions, and I guess it really depends on what you're trying to accomplish, and it depends on how you look at things. To me, if we think about health optimization, this is when you make small incremental improvements to key factors that influence your health and well-being. And Dr. Kelly Halderman and I talk about these things in our book, The Thyroid Debacle. We call them the fitness factors. Your diet, your emotional state, your sleep, your respiration, your environmental fitness, right? All these things, your habits, your social engagement, how well you and how healthy you are in each of these categories really determines how optimal we're going to be. So if you want to improve your health, if you want to optimize your health, you got to improve your health, your habits, and your behaviors. You got to improve your diet. You got to have consistent patterns and habits that are going to improve health and move you more towards optimization. Health manipulation, good or bad, in my definition, is using drugs, hormones, surgeries, even supplements to improve your signs and your symptoms, your dysfunction, your disease, without identifying and addressing the cause or causes. An example, somebody has high blood pressure, right? We can give them blood pressure medication. Somebody might say that's optimization to lower their blood pressure. But is that truly optimization or is that manipulation? Did it work? Sure, it works. Did it improve their health? Maybe, but did it actually address the real issue, or did we just manipulate the blood pressure into range? So is it right or wrong to do things that are going to be manipulating someone's health and well-being and calling it optimization? I think we just call it what it is. I'm not saying it's right or wrong. If you're on a person who doesn't convert T4 to T3 well, and you don't want to address some of the root issues, and you're just trying to get that T3 number into a certain reference range, fantastic. If the patient feels fine and you as the clinician think that that's the right strategy, that's great. But does it truly optimize the patient? It may not, because the body should be converting T4 to T3. The only way maybe we might consider that optimization is if they didn't have a thyroid gland. So the thyroid, we've lost the 5 to 10 micrograms the thyroid gland would normally make, and or that person has a homozygous defect that reduces the conversion of T4 to T3 via deiodinase 2. And in that situation, if they struggle to make sufficient levels of T3 to make them feel really well, giving them an extra 5 or 10 micrograms might might truly optimize them. But other than that, most times when there's reduced conversion of T4 to T3, it's because there's some type of cell stress inflammatory mechanisms going on. And if you just provide that person with T3, sure, it'll manipulate the T3 levels into range, might even change some values, patient might feel a little bit better, but does it truly optimize them? I would argue it probably doesn't. So the questions that you as the client or you as the clinician should be asking is the treatment, or first of all, is the signs, the symptoms, the dysfunction or disease the cause, right? That's like, if somebody has heartburn, that's what they may be complaining about, and you can give them a treatment that reduces the heartburn, but is the heartburn really the issue? It's what they may be complaining about, but what we should be trying to identify is what's the cause of the heartburn, okay? So treatment should really be focused on the cause. And is the sign, the symptom, the dysfunction we see, the reduced conversion of T4 to T3, is that really the cause of somebody's issues, or is why that T3 conversion is down is the cause? The second question we need to ask is the signs, the symptoms, the dysfunction, disease, broken physiology or adaptation? Now, some people would say if the person's not converting T4 to T3, it's broken. The body forgot how to do it. It doesn't have the ability to do it anymore. I actually heard somebody who's a big T3 proponent say, hey, we know that reduced calories and inflammation will reduce T4 to T3 conversion. And they were talking about why T4 to T3 conversions are reduced, and talking about how this is essentially saying it's an adaptive change. But then in the next breath, they said, that's why we need to give you T3. Well, if inflammation is resulting in decreased T4 to T3 conversion, and the body's adaptively decreasing that conversion because of the inflammation, why would giving more T3, even though it manipulates the T3 level into range potentially, why would that be optimized health? Shouldn't we address the inflammatory piece? So the next question is, does the treatment we're going to provide restore homeostasis? If the person's in an allostatic inflammatory state and the adaptive response is to decrease the conversion of T4 to T3, does giving them T3 restore a homeostatic state? And many times it does not. If somebody's got an ulcerative colitis and we take out part of their bowel, we've removed the disease part of the tissue, which may need to be done, but just removing that doesn't necessarily restore homeostatic function there. Something triggered that to begin with, and if all we do is take out the disease tissue and suppress the immune system, we haven't really addressed the root issue, and we're likely not restoring homeostasis. 4, does the treatment do no harm? And this is the big key. Sometimes we provide treatments to lower, let's say, blood pressure. Does that do no harm? Well, it lowers blood pressure, but it may reduce the amount of blood flow and circulation and oxygen that gets to the feet and gets to the brain, which then maybe leads to dementia in the brain and damage in the brain and neuropathy in the peripheral extremities. When we're providing thyroid hormone, does providing that person with more thyroid medication to manipulate levels into range, does it do no harm? And the argument I would make, and maybe some others as well, is that maybe it doesn't not do harm. Maybe it does do harm. Maybe it does change lab values. Maybe it manipulates those. Maybe it changes some symptoms. But does it improve overall health of the individual, or does it potentially create some challenges? And I see that taking too much or inappropriate thyroid medication often creates problems. And then number 5, does the treatment address the root cause issue? If the treatment doesn't address the root cause issue, then what are we doing? Now, what the goal of treatment is, if somebody just wants to manipulate levels into range and call that optimization, that's up to them. But my focus, and what I think functional medicine should always be about, is the treatment we're providing addressing the root cause? If it's not addressing the root cause, then it's just manipulation, even if it makes the labs look better. And then what are you looking to accomplish? If you're the clinician, what are you trying to accomplish? If you're the patient, what are you trying to accomplish? If you want to restore normal thyroid function and normal thyroid physiology, just loading somebody with T4 and T3 isn't the answer. If you have any questions, put them below this video. Hopefully this helps. Take care.